My name is Dr. Daniel Wainaina. I'm the Chief Officer of Public Health Services in the County Department of Health, Nakuru County. The Department of Health is the biggest devolved function, the biggest department in the county government of Nakuru that receives a budget of on average of 35% of the total county budget. We serve 2.2 million Nakuru residents, in addition to an extra almost 10 million from the surrounding counties, 8 counties, that is Narok, Bomet, Kericho, Samburu, Laikipia, parts of Kiambu, parts of Narok and Nyandarua County.
Hii ni moja kati ya hospitali 10 ambazo tumetengeneza hapa Nakuru. Ya kwanza iko Mai Mahiu na ni kubwa kiasi hiki. Pia tuko na Naivasha ambapo tumeshirikiana na KenGen na hiyo hata ni mara 2 kubwa kuliko hii. Tuko na Gilgil. PGH tuko na 2 kama hizi tumejenga, kubwa kwa gharama. Hapa Njoro sasa. Pia tuko na Elbagon. Tuko na Molo. Na sehemu ya Rongai tunatengeneza a level 3.
My name is Dr. Aisha Maina. I'm the medical superintendent of Nakuru Level 5 Hospital, also known as Nakuru PGH. Currently is really focusing on service delivery, how to improve our service delivery. So we are really getting our specialists back, and now we even have super specialists. We have disciplines like oncology, which has been running for the last 3 years. We get patients who are coming all the way from even Nairobi to get oncology treatment at PGH. So most of the referrals we are getting from our neighboring countries are coming in because of these specialist treatments.
We were referred to this center at PGH Level 5 Oncology Department, where we found a very loving and caring team. The first day was during the launch of cervical cancer awareness campaign led by Governor Lee Kenyanjui. I was diagnosed with immature teratoma, meaning ovarian cancer. Currently, I'm living a normal life. For months, I have been away from any form of medication. Both the chemotherapy and the surgery was a success. We thank you all for what you are doing in our community. The services offered here has enabled us to get treatment from our locality without having to travel. I thank you all, the PGH fraternity, Ministry of Health, and the government led by the President, which has enabled this possible. I know I'm healed and shall excel in my education and also help in the community. God bless PGH, God bless Nakuru, God bless Kenya. Shalom.
Today we are here to open the Regional Cancer Center to give hope to families, to patients, and all of us who in one way or the other are affected by cancer. When I was Member of Parliament here in Nakuru, the same issues we hear today of heavy burden, cancer burden, and there being no solution unless you go to Nairobi and other places, was still there at that time. But because health then was not devolved, we didn't even have counties, I worked with some of our development partners, and together we established the hospice that is just down here, so that we could offer the psychosocial support that was necessary then. But even with the hospice, we knew that there was a huge medical challenge that required to be sorted. And therefore, when we got into the office of the governor in 2017, we initiated a program to try and offer comprehensive cancer care here in Nakuru. So we started the oncology center just down here, where we've had the treatment, screening, and I am happy that what started in 2018, May 24th, as a small unit has grown in terms of numbers and reached many people, not just within our counties, but also beyond. But as they were offering the chemotherapy, we also realized that there's one aspect of treatment that we could not have here, and that was the radiotherapy. And therefore, working with the ministry and the PS in particular, we did a request for government to partner with the county so that we could set up this center. And I am very, very happy that our proposals to the ministry, not just on cancer treatment, but also on the other aspects of health, none has gone unattended. So we really want to thank you. Today we gather here to celebrate another milestone of a great cause and a great initiative towards the promotion of maternal, newborn and child health in our county. So as part of our efforts to provide accessible health services to our citizens, the Nakuru County embarks on an ambitious plan to build and equip an ultra-modern mother and baby facility. The hospital has seen an increase in mother attending at least one neonatal care visits from 82% in 2013 to 96% in 2014. Today, we are delighted that the journey we started 2 years back is fruitful. This is because we have delivered a new hospital wing that include a labor ward, a comprehensive newborn unit complete with an intensive care section, 4 operating theater suites, and a gynecology ward, a postnatal ward, and a mother accommodation section for newborn unit mothers.
I want to thank the Nakuru County government for cooperating with the healthcare workers as doctors, from the doctors all towards all the cadres. Thank you for meeting us in promotions. Some people have been promoted. Thank you for meeting us in timely remuneration. Thank you for meeting us in some partly unemployment. And thank you for even providing the facilities and the equipment that we are able to work with at the various departments in the various hospitals that we have in the county, all the 16 of them.
Initially, before COVID came, you were doing some good work. But COVID even brought your importance to another level. Because we started hearing things that I had personally not heard before, things like contact tracing. So somebody has turned positive in the area of Bondeni. We want to know where they were yesterday, who they were with, whether they went to church, and who came into contact with that person. And the army that helped us in the contact tracing agenda is the Blue Army.
On average, we use about 140 to 150 cylinders of oxygen every 24 hours. Therefore, we are happy to have this project commencing, a project that will ensure that PGH achieves or at least meets the target demand of oxygen on a daily basis. We have plans to pipe the whole hospital. We have plans to still compress oxygen in cylinders and utilize in our major units.
In cancer, you probably know we are the only county that does not owe cancer even a shilling.
Officially release this consignment of drugs going to all our hospitals from level 5 all the way up to the dispensary. The value of this consignment is about 100 million,
And every year we spend about $500 million shillings on buying supplies and medicine for our hospitals to make sure that at all times we have the necessary medication and other non-pharmaceuticals to ensure that our hospitals are running smoothly.
Nakuru County has a fleet of 30 ambulances that include 25 basic life support ambulances and 5 advanced life support ambulances. They are all captured in this ambulance dispatch system and the fleet management system. This system uses GIS to zone our county so that we are able to distribute these ambulances so that in every area Mwananchi is able to have an access to an ambulance in case of an emergency within the shortest time possible. We are going to have a toll-free number to our dispatch center that is going to be manned by paramedics and emergency medical technicians. Mass incidents, one signal is able to be sent and received by all ambulances simultaneously.
There are 47 governors in this country, but I can count the number who are always knocking at the door of Ministry of Health and pushing for us to collaborate and take care of their citizens. And so we have a long-standing relationship with the governor, who now I can say is my friend because of the many times he comes to my office to seek for help and assistance for the county of Nakuru.
Ni furaha sana kwetu kwa sababu tunajua pasipokuwa na afya hata ukulima haiwezekani. Hata kazi ama biashara ama nini haitawezekana. Kwa hivyo tumeweka mambo ya afya mbele kwa sababu tunajua a healthy nation is a working nation.